started. Thank you, everyone, for joining us today. Before I turn it over to the team, there's a few things that I wanted to share with you. Let me share my screen here. The first thing I wanted to mention to you, well, that's not the screen I wanted to share. Let me change that up a little. This is the screen that I wanted to share first. There were 2 email blasts that went out, one yesterday, one today. I have those images showing a couple things I want to share as a reminder with those email blasts in addition to the content that they provide. Please be sure that if you have the opportunity to share that sign-up piece for division email blasts, that you do that. We have found that a lot of times, even our own staff, they have missed the messages because didn't realize that, oh, this email blast system isn't just for specific individuals. This is for everyone. This is for individuals, families, providers, whoever is interested in the information that we share. We want them to sign up for those blasts. So please feel free to share that far and wide. I will show you when we go over to the landing page which one of those panels on the scrolling bars provides that kind of information, which a lot of you have probably seen numerous times before. So let's get there. Okay, with those 2 messages in mind, the first one I wanted to remind you of is StationMD. I know that we've put out lots of information about StationMD. We take it in and then, we suddenly needed it and we kind of forgot what was sent out. Quick reminder, StationMD button is located on the main DD landing page. That information is there. Those folks are available 24/7. You want to guide folks directly to this page. Let's see if it's going to load for me. Still thinking about it. Well, that's not fun. All right. Obviously, I can't take you there today. Yes, I can. It just opened in a different window. I'm not sure why it's acting that way. Anyway, StationMD page. You can find that information in the education section, some frequently asked questions, information specific to individuals and families as well as providers. If you click this button, that will take you directly to the StationMD page. So that is one piece of information I wanted to remind you of. Have questions about COVID, have a sore throat and a cough. What should I stay home? What do I need to do? Any of those things. And you can get lots of guidance about that through that button. The second piece I wanted to mention this morning is you will notice this big orange button across the screen that says Connection Case Management System. That was the other email blast that went out yesterday. Several of you have asked about when that demo would be available and what do we have in terms of questions and answers on that. How do I learn more? This page is finally live. When you click on that page, it takes you to the Connection web page. Here you're going to find the background on the project. You're going to find the scope. You'll see down below that there is a link. There are a couple links with regard to the RFP. There's a status section so that you can stay up to date in what's going on when. And then here's the piece that most folks have been asking for, which is the demo piece. This is the recording of the demonstration that was done on the system, and there is the Q&A document that is the follow-up. So one thing to keep in mind, this page will continue to evolve as we have more information available, as we get further into the project. If there are things along the way that you say, hey, it would be really helpful if this was included, by all means, feel free to drop an email to me or send it to DD Mail. We'll make sure we take a look at that and see if we can get that information out there for you. And with that, I am going to turn this over to Val.
All right. Thank you, Heike. Good morning, everyone. We continue to battle COVID in the state of Missouri. Today, we've learned that we have exceeded 200,000 positive cases of COVID in the state of Missouri. Yesterday was our highest total daily count of cases yet at close to 4,000. So those are big numbers, and those numbers continue to go up. I know a lot of you have probably seen news articles talking about hospitals are at their peak. We are not at this point looking at alternatives to hospitalizations, but there are, and that would mean like opening alternative hospital sites is what I meant there, but that is an option the state has and can make readily available. But there are some hospitals that are now reviewing what they will be doing around elective procedures, and I know hospitals are adding some surge capacity at this point. So I just wanted to make sure that I know that you're reading some articles. That is what we're getting out of the fusion cell, and that is with the Hospital Association reporting that information. For those individuals with developmental disabilities, to date, of those 200,000 positive cases, 764 of those are individuals that we support in our waivers. We've had 17 deaths to date. We had a new death added today. And we've got 175 different providers right now that are managing COVID or have managed a COVID outbreak. We actually have several new providers today. So I know I said this early on when we were talking about COVID. It's not if, it's when. And I think a lot of our folks are seeing that when right now. Also, on the testing side, and Heike, if you want to go ahead and pull up those community testing resources, thank you. Before we go into what Heike has pulled up onto the screen, the division had been supporting community providers with their testing efforts. We were doing that with CARES Act funding. Right now, we don't know the future of CARES Act funding, and so and that is largely because we're not sure how the federal government will proceed with CARES Act funding, if there'll be another round of funding for states, if there'll be some more directed testing funding delivered to the state. So as we work through that, the state's ability to fund community provider testing is going to end effective November 15th. We have to have all invoices in November 15th. So really, unless you're going to get an invoice the day you do testing. Now, if you've done some testing and you're working on getting those invoices, please continue to submit those to us, and we will try to work those through the process. But really, our cutoff date for community testing is probably now, and invoices need to be turned in on November 15th. That's community provider testing. That doesn't mean that I've quit, and we will, like I said, we will continue to try to find ways to restart that, continue that, make sure you guys have access to the testing you need. If you are a provider in a situation where you are just desperate to get testing, please reach out to us like we did early on, and we will work to try to figure out solutions for you. With that said, though, there are more community testing events across the state now than we have ever had before. I know that we send this out to you regularly, and we can send this link out to you again. Here's a list of next week's community testing sites. These community testing sites are run. They're free. You don't have to have a doctor's note. You do have to register online. I know we have a lot of folks that take advantage of these because they've called me and talked to me about how to handle results. But you just register online. You can get the test done. It is, I've done 2 of them in 2 different locations. It's been a smooth process. We did the testing on both of my kids there. For those of you that aren't aware, my entire family has tested positive for COVID. This is our last day where we will be 10-day recovered for the last 2 of us today. We are feeling fine, so thank you. But we did not all feel fine. We did have symptoms through the process, and some of those symptoms can be very scary. So I have experience with this. What the National Guard does with these tests, it is a self-administered test. So even my 10-year-old gave himself a COVID test, and my 11-year-old gave himself a COVID test, and they did just fine. So I wanted to make sure that you were aware of how that process works, but you do have to register online. Results do come back relatively quickly. That's one of the community testing options, because now, Heike, if you go to the next link, because of the recent increase in COVID cases in Missouri, the federal government has also instituted surge testing in the state of Missouri. This is also free testing, and it does not require a doctor's note. If you'll scroll down a little bit, Heike, these are testing sites. This testing will occur every week on these days at these testing sites. So you can see here the testing site details. In Columbia, Missouri, testing is from 10 to 5 every Monday at Memorial Baptist Church. In Branson, testing is every Tuesday from 10 to 5 at Cox Health. In St. Louis, testing is every Tuesday and Wednesday from 9 to 5 at Affinia Healthcare. In Cape Girardeau, testing is every Thursday from 10 to 5 at Arena Park. Lee Summit, Jackson County, testing is every Thursday and Friday in Lee Summit. So this is surge testing that is available in these locations on these dates and will be forthcoming. The state has been given 30,000 tests to administer through this surge testing process. So want to make sure that everybody is aware of these surge testing options. We will continue to review this list, and as there are changes made to this list, we will make you aware. But Heike, if you'll go to the next, there is a separate link for registration for this testing versus the other testing we talked about, the community testing. And so the Heike is showing that link right now. Do I need a COVID test? And this is how you register. And I know that we've had staff that have used this testing option also, and it was relatively simple to use as well. I did not use this one, but I know I've had staff use this already. So this is your second testing option, community testing option, if you're located close to those areas in the state. It is, and they show you the test locations on here too. You just have to go to the state of Missouri and they can pull those up for you. So hopefully that is some good information to help you in the meantime. I also do believe it has gotten a lot easier to contact doctors to get test authorizations, and there are still a large number of testing locations in the state that you can access if you have a doctor's note. So please also pay attention to that information as well. Okay, Heike, thank you. And Heike can post these links in the chat, and they'll also be on our FAQ for everybody. So I wanted to make sure that you were aware. And we'll probably push them out in a ding because that's what we do. So just pay attention, and we'll make sure you get access to those. If you lose them, contact us and we'll send them to you again because we do want to make sure that you can access that testing. Budget update, we did not get, I don't think the revenue report came out yesterday, so I'm not sure where we stand for October in terms of revenue. And there's no additional information at this time on the budget. They are doing a special session for a supplemental budget that does not affect the Division of Developmental Disabilities at all. So while that is going on and you may be hearing about it in the news, that does not directly affect us or really the Department of Mental Health. So I'm not concerned about that at all. CARES Act funding. So we have the $20 million that we got in the budget last year that we've been trying to get spent. We need to have that money also spent by November 15th. We did send a message out to providers that if you get us your information on November 15th and it's not accurate, we're not going to process your request. If you get us your information before November 15th and we've got questions, you've got to get those back to us by November 18th. If that does not happen, we will not process your request. But we've had a lot of really good luck with providers getting information in just even over the last 2 weeks. We've got one more week to get this done. So please, please, please submit this information. If what I am saying to you right now is completely foreign and you don't know what we're talking about, please reach out to your provider relations staff in your regional offices and do that immediately so that they can help you through this process. But those dollars are set aside for individual supported living, group homes, day hab, and supported employment. So I think we've gotten up to $11 million of that funding to date. So that is really good news. Then moving on to vaccinations, we did have an update on vaccinations yesterday in the Fusion Cell. The most recent information we have is that Missouri should not expect any shipment of vaccinations before the middle of December. And no vaccinations will be shipped until the CDC issues the emergency use authorization. So that's the thing that CD says these are safe vaccinations to be distributed to the state. So we'd earlier heard that could be as early as mid-October. We're now hearing that that's going to be mid-December. We don't know how many doses we'll get. We don't know any of that at this point. We don't know who the supplier is. So while we keep ourselves as educated as we can on that front, I did want to share that information with you as well. There is a question that I got, and it says, are residential habilitation provider staff required to wear PPE when in ISLs and group homes. And there is no requirement. I don't have a law out there that says you must wear. It is the best practice. It is highly recommended. It is how we operate in all of our state-operated programs, depending on what level of, if you have infection in a group home or ISL. If you don't have infection in a group home or ISL, that depends on what level of PPE. But I will tell you, in all of our homes, we wear masks all the time. So, and that's on the state-operated side. And I highly recommend that on the community side as well. I know it's exhausting, but yes, we do highly, highly recommend that. And that's all I've got on my list. So I am going to go on mute and turn it over to Angie. Angie, we cannot hear you.
Sorry, I thought I double unmuted myself. Can you hear me now?
Yes.
Okay, perfect. Okay, so we do have an update on our FMS, our fiscal management vendor contract has been awarded, and it will be fully implemented by April 1st of 2021. And we will be sending out formal notifications to all of our self-directed individuals, designated representatives, and support coordinators by the end of this month, and that letter will detail the transition timeline and planning, as well as providing a link to the new FMS vendor website. So be watching for that. And then I'm going to go ahead and give some updates on our federal programs unit in regards to waivers. As many of you should have seen, we sent out an email blast letting you know that CMS approved our most recent Appendix K submission. They approved that on October 29th. And that Appendix K submission was to reduce the unduplicated participants served and then to temporarily modify the provider qualifications for the ABA waiver services. So what that means is really that allows RBTs, the registered behavior technicians, that are unable to test due to COVID relating closures, test center closures, or delays in those tests, to still operate under the supervision of a licensed behavior analyst or licensed psychologist. And that Appendix K approval has been posted to our COVID website. And then additionally, you've seen the waiver amendments that we've been working on with the reduction of the unduplicated participants served and the removal of the person-centered strategies and counseling. Those have been submitted to CMS, and they are reviewing those. We'll have our first call with them next week. And then our renewal for comprehensive and community support waivers are currently under review at the Mental Health Net administration level and should be posted fairly soon for 30-day public comments. So thank you all for the comments that you've submitted to us informally and formally, just working through all of those processes with the amendments and renewals. I know it gets confusing with just the timelines on how we have to submit those. So thank you for those. And with that, I will turn it over to Wendy.
Good morning. Can you hear me?
Yes.
Okay. One thing I just wanted to follow up into Val's information on the CARES Act update, or the provider relief funding actually, is that we have a centralized, I'm pulling up my email now, a centralized email notification or request portal, centralized email to submit those requests effective November 12th. That email was sent out yesterday. And so look for that email if you didn't get it yesterday, or reach out to your provider relations staff at your regional office. Let me just read what Wanda wrote so I don't stumble around. As of November 12th at 4 p.m., all requests are to be submitted through a centralized email list. That notification and address was distributed yesterday. From that point forward, the 15th, until the 15th, all reviews will be conducted by a centralized team, and you'll receive communication from a state employee who's not previously had contact, if you've not had previously contacted with. So if you've not received that email or you have questions about that, as Val said, please reach out to your PR staff at your local regional office. I just wanted to touch base quickly on the statewide remote monitoring. We right now have all counties on a remote monitoring status. That does not mean that those TCMs or those support coordinators cannot go out and do a distanced face-to-face visit. If they are comfortable in doing that and feel equipped and have the means to do that, they can certainly go ahead and do that. And certainly if there's any health and safety issue or concern, they need to and are required to do that face-to-face visit. Some providers have wondered if that also applies to them. This is just, some providers have been using this as a guidepost about how involved to be in the community, perhaps, and this is not any mandate on providers of other services. It's not a mandate on our TCM providers either. It is just pretty much a status update. So providers of other services, day habs, or if you're doing community integration and other such services, just use that as information as you decide how to move forward with your programming. A couple questions that have come in. There was a question around funding medical equipment for families. Right now, the division does not have any resources to help individual families purchase medical equipment, but you might reach out to your Senate Bill 40 board and ask if they have resources to help or if they know of other resources locally that can help. You might also reach out to a provider in your area, because there are some businesses that do have community support grants that they work with. For example, I know that Cerner in Kansas City has a granting process that is only open to families and individuals who are working to get over a hump or have some thing come up in their life that has kind of set them back. They do not grant it to agencies, they grant to individuals and families. So you might reach out to any of your providers in the area who do fundraising, that they may also know of any of those local resources for you. So hope that helps for some of those families. If we end up with some money down the road that we're able to repurpose for these resources, we'll be certain to let you know. There's also a question in the chat about SDS flexibility and some information that Kyla had sent out prior. So I don't know the details of that information, but we will follow up on that and put it in the question and answer document so that you have those details. So look to the question and answer document for that. And with that, that is all I have. Kim, I don't know if your mic is working or if you had anything to add. Last I heard, her mic was not working. So I think now we can go to questions. Val, are there any other questions that have come up in the chat? I know that there's a question that came up about Reliance that before we get off the call, Heike, if you'd be able to speak to that.
There's one last question, Wendy, and that's about in regards to monitoring. It says in-person activities must be outdoors. Are we as TCM able to do indoor if socially distanced or required to be outdoors for any in-person activity? The answer is you can do indoor monitoring. We're not saying you have to only do outdoor monitoring, but that needs to be a decision that's made between the support coordinator, the family, the provider, the individual. So there's a lot of things that need to be taken into account. I totally think that indoor monitoring can be done safely, as long as you're wearing your mask, you're following the rules, don't touch a lot of stuff, don't send 10 people into a house, those kind of things. But again, it needs to be the decision of everybody involved. So I hope that answers that question. And if somebody wants to say something different on that, please feel free to. There's another question. Is there a date for tools training on Reliance yet?
I can answer that.
All right. Thank you, Heike.
I met with project manager again this morning. Our tentative launch date for having tools of choice training available in the MODD content self-registration portal is January 1. So that all of those files are with the developer now, and they are building the package, so we should be set for then. We will be sending out an email blast when those things are available in the process, which is a nice segue into the question about how to access those Reliance portals. best way to do this is to go to our division landing page. So if you even just go to dmh.mo.gov, click on the developmental disabilities, it will get you to this page. Community supports, education and learning. When you get here, this is your one-stop shop for everything you need to know about Reliance. There are 2 self-registration portals that we have. One, the first one listed is employment support self-registration portal. That houses 30 courses that will meet the requirements for individuals that need to have employment support training to meet the contract fees. The second portal, the MODD content self-registration portal, that houses primarily our created content. That would be abuse and neglect. That would be nursing delegation. It also houses the 3 refresher courses for first aid, med aid, and CPR. It houses the test for level 1 med aid administration. If you forget which one is which, what you're looking for, by all means, go to this page. It tells you how to access. It'll link you to the portal, what you need to do to get certificates. If you stub your toe and you're like, okay, I've tried all of this, I still need help, drop an email to ddmail@dmh.mo.gov, and we will get back with you and help walk you through that.
Heike, can you back up one and show how you got to this page right here?
Absolutely. So this is our main DD landing page. This is an access point into various different areas. You go down below to the popular sections. There's one called Community Support. When you click on that tab, you'll notice you have several choices there. One of those is Education and Learning. On the Education and Learning page is where you find the second accordion that has Reliance self-registration portals. We also have an event/training calendar that you may want to check out and some other things going on there. So by all means, check out anything and everything while you're there.
Thanks, Heike.
You're welcome.
All right. I think that's all we have today. There's no more questions in the chat at this point. Thank you for everything you guys are doing. It's not getting any easier. It's hard to stay vigilant, especially with the holidays approaching. But what we're seeing mostly now in the state of Missouri is community transmission from small family group gatherings, weddings, reunions, those kind of things. So just be safe, because just 1 second of not being safe can mean your whole family has COVID or someone that we support has COVID. And that's not, we want to do everything we can to avoid that. So keep being vigilant and good luck. Enjoy this beautiful fall weekend we're getting ready to have, and we will talk again in 2 weeks. Thanks. Bye.